much. And of course, we're starting the program once again by bringing us up to speed on how we're doing with COVID-19. Nigeria has just recorded 1,430 new cases of COVID-19. You got that right, 1,430. And that's according to statistics released by the Nigeria Center for Disease Control, NCDC. Lagos recorded the highest number for the day, which is 744. Followed by Plateau State with 100 new cases. Oyo State recorded 77 cases, the Federal Capital Territory 75. Nasarawa recorded 74, Kaduna 48, Edo State 42, Kano 41, Enugu 37, Rivers 34, Ogun 33, Kwara 32, Niger 28, Ebonyi 27, Kaduna 26, Borno 12, Yobe 10, Ekiti 5, and lastly Gombe recorded 1 new COVID-19 case. In total, Nigeria now has 122,996 confirmed cases of the viral disease, while 98,359 patients have so far been successfully treated and discharged. 1,507 deaths have also been recorded. Yesterday, the death record was 1,504. Today, we have 1,507, which means 3 more people have died in the course of the day. So, according to these figures, 19 states in total tested as at yesterday. All right, so still on COVID-19, the Nigerian government has said it will shut down all NYSC orientation camps that fail to comply with protocols put in place to curb the spread of coronavirus. The Minister of Youth and Sports, Sunday Dare, while speaking at the Presidential Task Force PTF on COVID-19 briefing yesterday, Monday, said the government was concerned about the number of corps members recently infected with the virus. He said the management of the NYSC cannot afford to risk the lives and health of corps members. In his words, going forward, any state that refuses to cooperate fully in the aspect of COVID-19 protocol adherence, full testing using the rapid diagnostic test kits and data management by the NCDC, and also the trained doctors, will have its orientation camp shut down. Mr. Dare noted that if the camps are shut, corps members in that camp will be reposted to the adjoining states. And of course, not forgetting to mention that yesterday, 13 corps members tested positive to COVID-19. Pushing it along, UK strain of COVID-19 is now in Nigeria. That's according to the Presidential Task Force on COVID-19. They disclosed that the B117 strain of COVID-19 has been recorded in Nigeria. According to Boss Mustafa, 4 persons have been diagnosed with the B117 strain in Nigeria. He said of the 4 persons, 3 are travelers from Nigeria to other places, while the 4th case was discovered in country. Also, the federal government extends the phase 3 of eased COVID-19 lockdown by 1 month. The PTF is also reviewing the guidelines on the implementation of phase 3 of the eased lockdown, which is due to expire today. All extant measures prescribed in these guidelines, which are subject to some modifications, are extended by a period of 1 month with effect from today, Tuesday, the 26th of January, 2020. Also, very quickly on COVID-19, the COVID-19 vaccines that we're expecting in Nigeria will no longer arrive in January. Secretary to the government of the Federation and chairman of the Presidential Task Force on COVID-19, Boss Mustafa, has said the 100,000 doses of the Pfizer and BioNTech approved COVID-19 vaccines expected in the country by the end of January will no longer arrive until February. Speaking at the task force's press briefing yesterday, Mustafa said efforts to access and deploy the COVID-19 vaccines are progressing. So hopefully between the 2nd and the 3rd week in February, those vaccines will likely come into Nigeria. All right, gentlemen, so that's it on COVID-19. Let's comment quickly.
Well, first and foremost, I'll start from the vaccine. We're looking at 100,000 for 200 million Nigerians, and I'm asking what is the need for us? Who is going to be entitled to getting this vaccine? And if I follow rightly, and what the last time it was. There was a division. There was a template showing what each state and the federal capital will get, and then who are the first people that will get it. And I'm asking, it's as if the 100 people gets it, what happens to the remaining Nigerians? So I don't think it is proper for government to actually be, boasting that they're bringing 100,000 for 200 million Nigerians. It's just dropping.
That's where it starts.
No. I don't think it's what we should actually be doing is that if the federal government doesn't have the funds to finance it, then the federal government should immediately stop state governors, maybe for 1 or 2 months or 3 months, from taking security vote. The security vote should be applied for this. We need to save the lives of Nigerians for there to be leadership.
Is it really a matter of affordability, in terms of funds, or a case of how much vaccines, the manufacturers can actually, release to Nigeria?
Well, if I remember correctly, I think there was a time it was talking about how much it was going to cost Nigeria to bring it in.
So it's a matter of cost.
The cost is also factored into it.
Okay.
Now, another thing I'm going to look at is talking about the NYSC and the need that some camps will have to be shut down. And I keep saying that it is one thing for us to keep talking on paper. The implementation is another thing. Now, you're talking of NYSC. Nobody's talking about the secondary schools and primary schools and nursery schools that are opened. Is it that COVID-19 does not affect children? So if you're talking of NYSC, who is talking about these children? Who is looking into their... If NYSC, with all the budget they have, you're not saying that they are not able to set protocols or obey the protocols. So how do you expect the secondary schools to do better? So I think it's let's move out of paperwork and let government go into practical. Let us begin to look at issues the way they are. Like I keep saying, the time is right for us to begin to think as Nigerians, as Africans, and begin to develop what suits us. What can we do as Africans to fight COVID-19? We shouldn't just be waiting for, whatever comes out from the Western world, where we'll wear it and we go, move on. Talking about the issue of social distancing, wearing of masks. How many people are wearing it? Go out in the street. There's no enforcement. Government should, if they know that these are the things that would curtail it, government should, at this point in time, be ensuring that there is total compliance. And to Nigerians, let me tell you the truth. I have just lost somebody to COVID-19, my in-law, and it is there. It is real. Let us not joke about it. It's unfortunate that a lot of Nigerians they will tell you, it's not our own, it's not in, but COVID-19 is real. We all need to take precautions, and that's why a lot of us who are parents are worried for our children who are in school.
All right, thank you, Ms. Chilaka. Dr. Maduka.
Yeah, I think I have issue here. When you talk about the NYSC youth camp, and you don't talk about the officials, because not the youth camp that is creating the problem, it's the officials. And I expected the government to say, look, you are managing this camp. If you're not following the due process, you're going to be fired. So you see, the issue about shifting blame, the camp is just a spell. It's just like Nigeria. You can't say, okay, I'm going to shop Nigeria when you have leaders. So I think that of the NYSC camp being short is just an issue about covering officials' inefficiencies. Any camp that is not functioning as by the modalities spelled out vis-a-vis this COVID issue, the officials should be held responsible, not shutting down the camp. Something the camp doesn't really exonerate us from the main issue. Who is in charge of that camp? That is one. Then when you talk about the issue about the U.S. plane in Nigeria, believe you me, sometimes I get worried. Why am I worried? The way our officials talk about it, it's more of like inflicting fears into us. And I asked, okay, the strain is here. What are the things you're doing? Because it's not just about talking, oh, the U.S. strain is here. You start counting the numbers. As a leader, what are the things you're doing to ensure?
What are you doing with that information?
Yeah. Because every time you keep on inflicting fears in Nigerians, fears in Nigerians, and you're not doing anything about it. And that's where I'm having a problem with them. You just keep on every time, this number, then what are you doing? Because as of now, it's not about the number. Everybody, we are aware, people read about it. We are looking at government that will say, look, this is what we're saying, but this is the area we are going. You see, locking down has not helped us. You can see the geometrical dimension of the increase. You know, yesterday it was around 1,000 something. Now it's 1,004, and we don't know tomorrow. And this is just 10 states. 19 states out of 36. So there's a problem. And of course, if you look at Lagos, I was driving now. I was just trying to do a sample, mental sampling. I discovered that the vehicles, the buses, the people, everybody's in charge of himself. And of course, this is real. Like Chilaka said, please, we have to take precautions. I know it's not about the government alone. And each and every one of us will have to take precautions because life is all about us. Then the vaccine, I don't know. I've always been against it, and I continue being against it in every fora I am, because see, we need to develop our own peculiar vaccine. The UK environment is not the same as ours. I know that they say vaccine is all about global. No. COVID-19 has a different dimension. One, the areas you have cold right now in Europe, America is almost like -0, and that is why the thing is very, very much in alarming rate. Here we have a little bit. Okay, I can say God is in us. God is helping us. When you look at the number, but I'm still believing that we can get something out of Nigeria. One professor in UI, I think Oyo State contacted him to evolve a remedy for COVID within Oyo State government. And the man came out with solid things that we can use in Nigeria that can help us. Vaccine that is not tested. More so, when there was an interview with Vaccine, recently, all of us saw it, and they were asked, okay, if I take this vaccine, will it prevent me from getting it? He said, no. Okay, if I take this, will it prevent me from infecting? No. And then you keep asking yourself,
so what is now the essence of the vaccine? Sorry, I'm butting in. I saw a story yesterday about the WHO saying the COVID-19 vaccine is not going to be enough, for COVID-19. So you're wondering, what is all the hype about, really, about this vaccine? What is it meant to do?
That's my problem. That's exactly my problem. Because I know polio vaccine, if I take it, I know I'm immune. I could stand and, withstand whatever.
Exactly.
But this COVID, I've looked around, I've researched a lot, I've not seen where they say this vaccine is going to take care of it. Then why are we rushing into it?
What's the objective?
In fact, taking the vaccine doesn't mean you can't spread it.
And you can't get it back. You can still get it back. So that's my problem.
I thought the information was that some of them are about 95% effective. Some said 90% effective. So with 9% effectiveness, it's not bad. It reduces the chances of getting it by 90%. So the chance is just 5%. And that's manageable, that's tolerable. But it's not my forte. It's not an area I know much about. The thing across board is that I realized, I don't know why, maybe increased government education, increased awareness, but I noticed that more people now wear masks on the street, on the average.
Yes.
And I don't hear anybody anymore saying there's nothing like COVID. Nigerians have come to terms with the reality that COVID is there.
Because it's getting closer.
Yes,
whether you like it or not.
It's getting closer home.
It kills people, and so those are encouraging factors. More people are taking precautions, and that's good, because that's the best we can do. We cannot afford another lockdown, total lockdown. So the thing is just for people to adhere strictly to the protocols, the guidelines, the preventive guidelines. You see, the issue with the youth corps camp is a very complex one, because those youth corpers are at this age where they are in this hot enthusiasm of youth. In their exuberance, they think they are invincible. At that age, that's the age that go to the military, because at that age you think you can't even die. You think you can survive anything, you see. So with a collection of hundreds of people with that mindset, the administrators or those guiding the process should better be careful, you know. Children might readily be intimidated by fear of the teacher, but at that age, people are not intimidated and they think it doesn't concern me, I'm too much for it. So I don't know how they're going to handle it. Firing the thing in Nigeria is these days is that if you steal government money, you don't go to jail, you don't get punished. They say refund the money, okay? And so there's no more punishment for offenses. So if the administrators, if those running the youth corps camps cannot meet up to the designated standards, they should be fired. They should be arrested. They should be prosecuted. They should be jailed. But they say, no, we won't arrest you, we won't prosecute you, we won't fire you, we'll close down. That's the Nigerian mentality. I call Nigeria a vast scene of confusion, because everything is upside down. Every institution is dysfunctional. So the way we do things is just so upside down. But they better be very careful with the youth corps camps, because the rate of transmission will get out of hand with the mindset of such youths, the way they approach life. Vaccine, the thing with vaccine is the problem with Nigeria is partially cost, inability to purchase. The government was giving a figure at one point at what it will cost them to vaccinate every Nigerian. And I don't think that money is available. They're trying to scout for the money. And some countries have paid in advance for hundreds of millions of these vaccines. Nigeria has not paid a penny. I think they are relying on free gifts. That's why they are giving them 100,000 for a country of 200 million. There was this vaccine that was discovered in Madagascar. Nobody talks about it anymore.
Yeah, because
because let me just add, because after the president of Madagascar talked about it, it was like boom, people started dying in Madagascar. Yes.
Was that the vaccine?
No, it was a herbal cure. Yeah, so yes,
not a vaccine.
And let's not forget, Madagascar has pulled out of the World Health Organization.
But African countries,
Zambia president has even mentioned that nobody is going to be injected with that vaccine until it's tested and proven by our own scientists, our own technology.
Where are your own scientists? Why can't they discover their own vaccine?
That's my problem.
You discover vaccines across the ocean, and they want to now scrutinize and certify. If you're that knowledgeable, you can't discover your own. You want to scrutinize and certify someone's own vaccine. What nonsense is that? Africans want to blame the whole world for their problems. Nobody is causing the problem of Africa. Africans are causing their problem, period. So let's take any vaccine we can get and use. The Prime Minister of Britain used the vaccine. The American former Vice President Pence used the vaccine. The American president is using the vaccine. And Africans want to show that, no, we have to reinvestigate. Let them go and sit down.
No, I think there's a fear. There's a fear there, which is a question everybody's been asking.
Yes.
The vaccines being administered in the US and in the UK, in Europe generally, is it the same quantity of vaccine that is coming to Africa? That is the fear. That is the fear.
That's a valid concern.
And more so, you just mentioned it that we are looking for free. You are looking for free food. And somebody will not give you.
And you want to eat caviar. You want to drink champagne.
They will give you what you need. They can afford to. And probably that's why you say when somebody was telling me something. I'm sorry to digress on this. condom they used to bring to Nigerians, you know, some of them are fake, some of them, because they are giving you free. And the worker will be selling it at 20 naira. People are buying, and that is the worst thing.
They are rejects.
All right,
They are rejects.
we are not going to drop only on COVID-19 for the rest of
You're looking for free gift.